Bismillahirrahmanirrahim. Wassalatu wassalamu ala rasulil kareem. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to the next session of our Health Expert Talk series. And we are honored today to welcome two senior NHS consultants, endocrinologists, diabetes specialists to our masjid to talk on a very important subject. Looking forward to Ramadan being only a few days away, and considering how prevalent diabetes is in our population, this is an extremely important topic, and we're delighted and honored that our honored guests have given their time and their efforts to come and speak to us about this, and this will be a very beneficial talk for the whole community. So we are honored to have with us Dr. Khwaja Nijamuddin and Dr. Muhammad Al-Dalla Ali. They are consultant endocrinologists, diabetes specialists in Blackburn Royal Hospital. And welcome to you both, and I'll hand over to you now.
Jazakallah. Assalamu alaikum. I'm Dr. Khwaja Nijamuddin. Thanks for the introduction. I'm one of the consultant diabetologists here in East Lancashire Hospital, working since last 4 to 5 years now. I'll let Dr. Ali introduce himself, and then we can make a start about the important topic of diabetes in Ramadan.
Jazakallah. Yeah, my name is Dr. Muhammad Al-Dalla Ali, and thank you for the introduction, Dr. Nazar, for this talk. My name is Muhammad, and I work in East Lancashire for the last 3.5 years as a consultant. And subhanAllah, this talk, I should say this in the beginning, because Dr. Nizamuddin has prepared this talk a few years ago when we were in training, teaching other consultants, other healthcare professionals about diabetes and Ramadan. And this talk, based on the first presentation, it's always like a few changes, but it's always the same presentation that we're using to educate people in different places. And just last week when I was visiting Iraq, I mentioned to Dr. Nizamuddin that I used the same presentation but just translated it to Arabic. And alhamdulillah, I did the presentation in 2 of the masajid there, and many people attended there. So alhamdulillah, and jazakallah khair, Dr. Nizamuddin, for making these slides available.
Jazakallah, brother. So we'll make a start. It's about diabetes in Ramadan, as the topic suggests here. It's about the guideline and recommendations that we as healthcare professionals follow and guiding our patients to go through the holy month of Ramadan. And the guidelines recommendations are mainly from the International Diabetes Federation, IDF. It's a pretty extensive guideline. It's about like 300 pages guidance. So it's summarized the essential bits that will be more relevant, we think, to our public or our patients. The Diabetes and Ramadan is the second society that we've used making these guidelines, and the Diabetes UK is available to all of us. It is also a very good resource for diabetes-related education, including it has got a section on Ramadan and diabetes as well. So further, we looked into the abcd.care, which is again the Diabetes Society for the UK, and as I mentioned, the other couple of resources we have used in the guidelines. So our aims and objectives of the talk will be understanding diabetes. It's important to know what is diabetes, because that helps us in actually figuring out what is the challenge, and diabetes is a problem that can be further actually squeezed by, or you can say sort of compromised when we are in prolonged fast, and how do we tackle this in a safest possible manner. Importance of Ramadan and diabetes is another aspect we'll be covering in this talk, along with the tools that we use as a physician actually to assess our patients and guide them whether they are okay to fast or they could be high risk, and if they are high risk, how do we support them. Then again, ensuring safety and health during this holy month of Ramadan, as it explains itself, that we will discuss in the talk, and we will mention individual drugs and insulin. How do you work around that? The reason we have actually included these in the slides is we thought our patients, some of our patients will be attending here this important topic, they probably would know about their drugs or their insulin, and they can better weigh themselves or judge themselves as well, like, which category they fall into and what are the aspect of their diabetes care during Ramadan that they can discuss with their healthcare professional when they go for their next consult. And then finally, signposting the audience to the relevant resources. So first of all, what is diabetes? Diabetes is a well-recognized illness, and it's a very common problem, one of the common, like blood pressure, hypertension as we call it, and diabetes. But it's important to know what exactly is the diabetes problem, what happens, and the definition as per se is actually, our body is unable to utilize the sugars that we consume or the carbohydrates. The carbohydrates is processed into sugars. So normally when we eat carbohydrates, these are absorbed from the gut and they will go into the cells, which is the basic element of the human body, and these cells utilize this sugar for calories and for different processes, including conversion to fats and proteins. So what happens in diabetes is we are unable to take that sugar from the blood into the cells. This could be either due to having this process happens with the help of insulin, which is a hormone, and this insulin naturally is released by the pancreas, one of the tissues that sits behind the stomach and the abdomen. So normally what happens, the insulin will take these sugar molecules from the blood into the cells. So if we don't have any insulin, then actually that process is not there, it's not working. So we will have sugars more in the blood rather than in the cells. And that's why when you do a finger prick test, you have got higher sugar reading on the blood sample. And this person lose weight because they're losing sugars from the blood through the urine, into the urine. And they feel tired because they are not getting all those carbohydrates for the energy or calories production. So that's how it works. Now, alternatively, it could be resistance to the insulin, which means there is insulin released by the pancreas, but what happens at the cellular level, the insulin, when it attaches to the cells, it is unable to take the sugar from the blood into the cells. So it's either lack of insulin or resistant to insulin. The common one that we see in our ethnicity, in the South Asian ethnicity, or the non-Caucasian, I should say, is type 2 diabetes, which is the second one, where we have resistance to insulin. So we do produce insulin, or pancreas do produce insulin, but we get resistance to insulin. The good thing in the context of Ramadan with type 2 diabetes is it's relatively less risky. And mostly it is well controlled by lifestyle than tablet form of medication rather than insulin. Yes, some people will end up on insulin as well, and there is so up, which we'll discuss later on in the slides. So there are other types of diabetes as well. You might have heard about pregnancy-related diabetes called gestational diabetes, and there are some genetic diabetes as well that runs in families. It's a more rare form. But that will be beyond the scope of this talk. But the pregnancy-related diabetes is relevant as well, which we will touch base on a bit later in the next few slides. So in Ramadan, as you can imagine now, it's all to do with the fasting in Ramadan. When it comes to the actual act of Ramadan, of course, there is a spiritual element to Ramadan as well. But from the diabetes perspective, we are stopping eating from suhoor till iftar, which could be more than 8 hours, which we know that if it is more than 8 hours, then our body go to a fasting state, and the physiology actually has to alter a bit to overcome any challenges that it has to face. Now, on top of that, if someone has got diabetes, we know that their physiology is already altered, and they may be on medications as well at the same time. And these medications could be high risk of, either making the pancreas to produce more insulin, or it could be simple as insulin. So that's why it's important to know about how it works when it comes to diabetes patients and they are planning to fast. Then as my friend and colleague Dr. Ali said, this topic we deliver it to non-Muslims as well, to our consultant colleagues and our departments as well. So there are some facts about what Ramadan is, and just to make them understand about. But for us, it's also important to know if someone approaches you or asking about their fasting and Ramadan, it is important to know the geographical variation is an important aspect of Ramadan and diabetes. If someone is living, for example, in very north of Scotland during summers, during the fasting is Ramadan is happening in June, July, versus another person who is on the equator or in the south, then there is this time difference there. So each one, the same person, if they are fasting 1 year on equator, second year they are going to the North Pole of the northern part of the Scotland, the risks varies. It is different. So they have to be reassessed. So it's not a fixed thing. It's a dynamic one. And the same applies from year to year as well, because we know that it's a lunar calendar and it will rotate during summers and winters over the course of time. Along with that, diabetes itself is a dynamic problem. So as our body evolves through diabetes, it mostly goes downhill. We need more medications. We end up on insulin. So again, the risks should be looked into on each yearly basis. If someone is being asked, you're good to fast, you come under the category 1 or you're actually green, then it doesn't mean that it's going to stay the same for the next 2-3 years. They need to be reassessed again next year. So there are some these aspects of the diabetes assessment for Ramadan which should be actually considered when you are seeing your clinician. You should know that you need that assessment on yearly basis. So yeah, I will leave there to my colleague Dr. Ali to talk about next few slides. And I should have mentioned that earlier, but if there are any questions, I know it's online as well, I've heard. I don't know if there is any online system for the questions to ask, but from the audience, any questions we can answer them towards the end, or if there's anything not clear, please stop us. We can clarify that then. Thank you.
Jazakallah khairan. I don't know what's the time of Maghrib, just for the purpose of the prayer. Should we stop now or should we? 2 minutes, okay. Probably we'll do 1 or 2 slides and then we can stop, inshallah, for Maghrib prayer. To continue with what Dr. Nijamuddin has started talking about, the background of Ramadan and diabetes, there are few exceptions where, like circumstances where people need to consider not to fast for Ramadan. Example for that, like having acute illness while having diabetes, being frail people like elderly patients, traveling, which can apply to diabetes patients, but also even non-diabetic patients, as our religious leaders know, they can have the exception of not fasting, and pregnancy and breastfeeding as well. We know it's a personal choice. It's not like the guidelines that have been made are not like fixed template for everyone, and it's a personal choice at the end. Some people will take the risk despite being informed about the risk, and some other people will probably listen to the healthcare professional and avoid fasting during Ramadan. And as Dr. Nijamuddin mentioned, it's always important to prepare in advance of reaching Ramadan by speaking to the healthcare professional, because each patient is different to the other one, and there is no fixed template for everyone. And as we know from the Quran, the most important thing is to take care of our own bodies, and that is essential bit of our religion. And therefore, if fasting can be a reason for causing harm to our bodies, then it's advisable not to fast. Mashallah, our masajid, they have religious leaders, and the imams, mashayikh, they can advise as well about that in more details. The main things that we would take in consideration of whether the patient is at high risk of fasting or not is if they have developed what's called hypoglycemia, and hypoglycemia meaning very low sugar reading. And in the measurements in the UK, they use millimole, which is like 4 millimoles. I will stop in a few seconds, inshallah, jazakallah khair, for the reminder. And then dehydration as well can happen, especially during summer, where it's like many hours of fasting. And for type 1 diabetes patients, they can develop what's called diabetes ketoacidosis, where they can become very unwell, where the acid level in the body can go very high because of high sugars. So these are the main things that can put the patient at very high risk to fast during Ramadan. I will stop here, inshallah, and then we'll complete after the Maghrib prayer. Jazakumullah khair.